So, hi, and welcome to Avarian Insights. This is Aaron Wootton. I'm the Chief Digital Officer of Avarian. I've been with the organization about 2 years, and today I'm very pleased to introduce our guest, Jae Zayed, who is coming to us from Southwest. Jay, how are you doing today?
Hey, I'm doing well, Aaron. Thanks for having me today.
Yeah, thanks for coming. This is exciting. We're going to talk a little bit about AI. We're going to talk about digital, the application of those to a health system that is very much in that middle segment, trying to do what's right for the community and improve health for the community. And I'd love to hear a little bit about how you describe Southwest and how you see the organization fulfilling its mission.
Yeah, absolutely, Aaron. So first and foremost, I've been with Southwest for about 3 years now. And Southwest General is a 100-year-old community organization with deep ties to the community. We are one of the last independent health systems in the region, and that's something that we are very proud about. And with that, our mission goes along with delivering and being dedicated to delivering high quality care, very patient centered, to the communities here in Southwest Cleveland. With that mission, we find it very exciting to be able to drive through our digital transformation. And what we'll hear about today, Aaron, because I know you have some great questions, is how we're also ticking and tying AI and utilizing it to drive to our mission, but also the vision of the organization.
Yeah, that's great, Jay. That's a great intro. And now that we understand the foundation, it's how do you translate some of those ideas into action, right? Do you want to expand a little bit about that foundation that's in place at Southwest and how you develop that foundation?
Yeah, I mean, I always say, AI shouldn't be separated. It shouldn't be a black box. It's not isolated and it's integrated. And I think this is something that we've done at Southwest General with support from my leadership team is ensuring that AI is embedded and it's enabling our strategy, our corporate strategy that we already have moving forward. So I wouldn't say that I've created anything, out of the ordinary, yet just bringing solutions to problems that the organization has identified, driving through those initiatives, and using a little bit better technology than we've been used to in healthcare. Um, we look at these things through ROI, patient safety, patient experience, engagement, and how we can get the biggest bang for the every dollar that we spend in technology.
So Jay, when you looked at AI adoption, how did you identify the highest impact use case?
Yep. Our driving factor is obviously our corporate strategy. I just get the excitement to bring in, new, better technology than what has historically been there on the market. But I think it all goes back to data, right? It all goes back to pain points that we've identified with supporting data. And those could be across the organization from an access perspective, from a throughput perspective, and, I think what's even plaguing healthcare even more is that true administrative workload. So when you look at your data points, you look at your pain points, you have an understanding of your corporate strategy. For us, we kind of walked into where we wanted to apply AI that had the highest ROI, that we had repetitive ways that we could identify the ROI, and especially after the fact changes that have been applied, and once we had that understanding, we had our top three, top four identified, and we decided to move forward. So, high level, it was all about our corporate strategy, the pain points that we identified, the initiatives, and then plugging in AI where we felt it was the best fit to drive ROI for the organization.
That's great to hear. And I've worked with a lot of different organizations that handle that in a lot of different ways. I'm curious. There's some that take a very structured approach to identifying ROI, and there's some that think of it more from a strategic standpoint and mapping to strategic value for the organization. Can you elaborate when you say ROI? What exactly does ROI mean to you in this case?
Yeah, absolutely. So, return of investment. I always say that if we spend $1, we want to try to get $5 back. But our return on investment was, how do we drive down readmission rates? How do we reduce our length of stay? How do we reduce our no-show rates? How do we increase patient experience and patient engagement? How do we drive leakage and ensure that we're retaining the revenue in our organization? From our vantage points, those were all equal kind of a return on investment of investing in our people, investing in our processes, and obviously what we're here today about is investing in our technology. Um, Aaron, did that answer the question?
Yeah, absolutely. And you do, from our previous conversations, you do have quite a bit of data to support that, and we'll get into that a little bit later. But one of the things that that I'd like to understand is there's always this balance of like full steam ahead. Let's innovate, and kind of the clinical validation of things, and making sure that it's going to meet the needs and the risks are mitigated. And how do you strike that balance? And do you do it on a case by case basis, or do you set up structures that do it across the organization? What's been your approach to doing that?
It's a great question. And And I think to your point, I would land on that is um, our inbound process, our intake processes of where we decide to, buy technology versus build and kind of blend. We are following, HHS, NIST 2.0, and some other regulatory guidance that allow us to put a very strong, structured way on how we analyze any type of AI investment, or for that fact, any type of technology investment before we even pull the trigger or before we even pull the change lever to invest. So that's kind of the first swipe at it. There going forward, we also have a very top-down approach with how we discuss, how we analyze, and how we decide that technology is going to be a best fit for the organization. And as you know, with senior leadership, that takes a very corporate lens, it takes an IT lens, it takes a clinical lens, it takes a medical lens. In the community or cohort of our senior leadership, get to have those open kind of discussions. Now, when it comes to balancing, we've been very focused on speed to value. Um, Technology is changing on a day-to-day basis, and as you know, AI is rapidly increasing the ability of change in healthcare organizations. So, in addition to that, we've structured up through IT governance as well as clinical governance. And I'll give you an example through some of our nursing operations on how technology is going to not replace but also augment and uplift clinical decisions in the workflow. And all of these aspects have played a role in how we balance the speed of innovation. And I think a key deciding factor on that is this, the triple B. Do I build it? Do I buy it? Or do I blend it? I think our kind of direction there was, we're going to try to reduce our risk by not trying to have the skilled workforce that understands how to manage this technology, develop this technology in the four corners of the organization, but actually relying on partners in the industry that are best practice, follow all the cybersecurity best guidelines, auditing guidelines, and partnering with them to allow us to move faster than we feel we would if we had built this in-house.
Yeah, that's great to hear. And I know a lot of organizations struggle with that, in terms of the triple B. It's what approach am I actually going to take to deploying AI? I know I want to do something, but I'm not sure which path to follow. How did you land on that path? And would you say it's like this is it? This is what all organizations should do? Or is it variable based on the size or complexity in the organization and the resources available? Can you give a little bit of color there?
Yeah, I think it obviously would rely on the size of the organization. We're a small community hospital. We have an outsourced IT department that with one of our leading vendors that helps us manage our supports and our tickets. We had to have a reality check in the skill set required to be able to manage AI into its fullest, from the technology, the infrastructure, the training, the weeding, the feeding, the constant quality checks. And we felt that we would not have done the best advantage. We would not bring the best to the table. So with our variables, we decided that we would go the I route. However, that's not a one size fit all. I think each organization is going to have to take it where they're wanting to go, where their strategic initiatives are going, understanding their people process, understanding their people and their skill set. I think will allow them to hone in on what direction and what, of that triple B path, what is best for them with the variables that they have.
Yeah, that's great to hear. And you say I'm a small community hospital, but what you're doing today and the way that you've accomplished it is a model, I think, for other organizations around the same size, because what you're further ahead than many large academic medical centers in terms of what you've been able to accomplish. And I thank you for coming on, because that's the model that I think that people in those small to mid-size community hospitals can take to really accelerate things. In terms of tooling and infrastructure design, cloud, on-prem, hybrid, what has allowed you to scale your AI initiatives? How do you think about the underlying foundation of what you're deploying?
Yeah, and I don't want to hit the easy button here, but having the understanding of, as we mentioned before, applying this technology, we have a remote hosted EMR. We have remote hosted ERP. So a lot of our infrastructure is a very already an RHO remote hosted with multiple clouds where I don't have to worry about the loads and where my loads are going to take place. I feel I'm very fortunate with that, with the decisions that we've made historically. However, we do have to take into the fact the transfer of data, the securing of that data, where it lives. And I think this has allowed us to drive down to what partner you select. The rapid pace of AI. There are so many vendors, and you could argue, from a legal perspective, these ambulance chasers, that there's so many vendors out there that are chasing this wave and kind of chasing this bubble as it continues to build up. As I mentioned before, we understood where we wanted to go. We understood, our strategic principles and what were guiding us to get there. And I think with picking the right partner that we chose, we were allowed to check all of our boxes when it comes to patient safety, check our boxes when it comes to data privacy, as well as check those boxes where we didn't feel that there was going to be a large lift when it comes to how we managed our infrastructure, what changes we have to do to our infrastructure, et cetera. I mean, at the very low bottom of it, it's setting up a VPN in a structured path, embedding some RPA bots into our medical record, and ensuring that we had the kind of that responsible AI wrapped around everything we did, um, that allowed us to end up in the place that we are today. If we would have taken a different tact, I think it would have been very, very different. We also are fortunate over the last 3 to 5 years, we have been able to update our infrastructure from a disaster recovery perspective, a data center perspective, switching wireless. But as of right now, I don't see those as enablers or detractors from where we're going in the AI space, considering how we've managed, built our infrastructure from a remote hosting perspective.
That's awesome. And switching gears a little bit, technology is certainly a big part of success with AI, but so much of it depends on culture and your ability to measure it. And as you talked about previously, talking about ROI and being able to show ROI. Um, AI adoption requires trust, governance, and clear metrics. How does Southwest ensure success?
It's a great question. We pride ourselves in trying to understand what success looks like. And it's something that we talk about on the kind of initiation in planning prior to kicking a project off. It's what do we need to measure? What are we trying to change? What are we trying to improve? And as I said before, a majority of this movement is being supported top down from our CEO, from our CFO, from myself and other leaders across the organization. So having that support top down really allows us to accelerate where we're going. And Aaron, I'm going to have you repeat the question just so I make sure that I answer it adequately.
Yeah, well, it's just how do you ensure success
Success.
there? Yeah.
So it's measuring early on and then continue as this project continues to move forward. We are almost weekly, and I know myself is weekly as the project go on, trying to find out where we are against the benefits from a realization perspective that we set forth early on in the beginning of the project. We are very transparent on where we're going. We're very transparent on the data that we obtain from the life cycle of the project. And I think it allows us to a couple things course correct, right? Because we want to make sure that these things remain successful. Because as you know, these things are so new. Trust is already a little bit fragile. We want to make sure that we capitalize on that. So it's getting the data in the hands of the staff that have the most impact, as well as ensuring that if we are successful, that we also can be very loud and proud that and communicate that through the value streams that are currently impacted with the technology.
Yeah. So you've got great buy-in at the top, right? And then, from there, it kind of trickles down throughout the system. And you have multiple work groups. Do you spin up work groups related on the initiative? Or, from a practical governance standpoint, how structured versus um, ad hoc do you make the governance below that top level?
So governance, we have the same pillars. We try to be as lean as we can when it comes to governance. So we have our IT steering committee, we have the senior leadership committee, and we have a plethora of other committees that are supporting this. But in addition to that, every project has a project team, project membership, charter, etc., that we branch off. And this project team is the one that obviously moves through the normal break fix and the driving of the project, but it also reports back from a membership perspective to each one of those governance structures where we feel that we would have impact. So, given an example, Aaron, when we rolled out our ambient listening, one of the key pillars that we would always go back and rebels against was the physician IT committee. That was the group that had the most impact. That was the group that had the most, to gain and to lose. And those are the ones that we partnered with from a project perspective. And then natural hierarchy. Once the PIT committee met, we would obviously take those actions, decisions, their normal trajectory through the other remaining structures.
That's great, Jay. And then, you know, the metrics, the KPIs that you develop, the things that you track, the ROI that you talked about, and productivity gains from AI adoption. Where are those reported, and to what level do you keep track of that on a per initiative basis?
It's definitely per initiative base. Each, as you know, each initiative has a different set of, key objectives, benefits, as well as, the KPIs or the indicators and how we validate our success. Um, I personally like to communicate those all the way across the hierarchy. So there's communications that obviously would start at senior leadership, where it's myself, my peers, and we're in a meeting with the CEO. I have dashboards that I present every first week of the month. From there, we communicate out through email, everyone all, to boast or to give indication of where we're at from a project perspective, what we've been able to achieve, what's around the corner. And then, as I mentioned before, in the various um, governing bodies that have a stake, we also communicate down through those structures. We want to make sure that everyone is in the know where it is, where it's going, and what benefit that we've been able to drive through in the organization.
That's awesome. And I think that gets to culture change, right? I mean, because with those data points, then you can reinforce the change that you're trying to make. And you've been on a journey, I'm sure, from your first AI project to your 10th or 100th, or I'm not sure how many you have in place today. Do you know how many you have in place today? Do you have a concrete number?
Concrete number, I would say we're close to like, and I'm not talking of AI that's kind of embedded into technology. We are probably right now currently looking at about 6 to 8 large organizational AI projects that we're currently in flight with today.
That's awesome. And from your first, yeah, go ahead.
Your culture, your culture piece is exactly on spot. Coming into the organization and taking on this new role and trying to run with AI in the organization, there was a little bit of a resistance, and I think naturally so. Staff not being not that educated, but not understanding it leaves a little bit of doubt and pushback. And I think you probably, as the professional you are, have heard, it's going to replace staff and it's going to take human jobs. And, one of the things that I wanted to do is humanize our AI initiatives. So you'll probably hear me talk through how we've given names to our AI agents, names to our bots, and it really has helped us shape the culture of where we're going with these initiatives, but it also has started to peel back the initial kind of blockers that staff naturally put towards something that they may and may not understand.
Yeah, and there's a little bit of a fear factor, right? In terms of like AI is coming, the bots are coming. Like, you're gonna they're coming for my job. How'd you overcome that?
I think it's, again, not really magic sauce, but it's just being front and center, taking every opportunity from a leadership perspective to stand on the stage and talk about it. Take every opportunity to walk around the halls and just sit down with staff and understand where their understanding of AI is. Show them how, the 42 different ways that it can help them today without changing their hours, where they work, how they work, etc. And it was really just taking the mist of it away and getting down to solid facts of what it is, what is it isn't, and where Southwest wanted to appropriate it going forward. So I think really it was just communication, education, and I think what's also important is if you say you're going to do it, you actually have to do it, because it just raises more doubts. And from a speed to value perspective, it doesn't add any value to consistently try to hit roadblocks as you're trying to build these AI initiatives across your enterprise.
Yeah. And let's shift gears and talk a little bit about some of the specifics of what you've implemented and the impact that it's had within the organization. Be great for you to highlight, one or two killer use cases. You talk a little bit about ambient. I think people are very familiar with that one. You want maybe start there and then give us a couple more.
Yeah, I'll start there. So ambient listening, we started this journey in February of this year. So about 9 months live in a week or two on the technology. We have inpatients, outpatients, and ED, all three service areas utilizing AI. We have from an outpatient perspective, and I'll give you some numbers there. I won't go through each one. As of last week, we were 80% adopted. 80% of all our outpatient visits were done or through the use or supported by AI, which is just phenomenal. Um, so ambient listening across, from a physician perspective, one big initiative we also looked is embedding AI into our digital front door from a pre-registration perspective. Patients getting their appointment reminder, being able to reschedule, have direct insight into our physician schedules. But also, if they did accept or confirm that appointment, they have the ability to update their driver's license, their insurance by taking a picture of it or uploading a document. We have our computer vision coming and combing that information and injecting it into the EMR. And as you can imagine, just those two kind of small lift items from a technology perspective has allowed a better throughput at the front registration office. It's allowed our staff not to have to focus on that duplicative data entry. And then as the patient goes on through the pre-registration experience, they can complete preclinical forms that the nurse would ask them that they can fill out on their mobile device or on their desktop, sign their consent forms, pay their copay. And once that digital experience is completed, they digitally arrive to the clinic. And we've been able to see some great outcomes. And I know we'll probably get into some of the kind of key data aspects. One thing we're also moving forward with, and I'm very, very excited with, is our rate and call it Project Radiant. Radiology automation and intelligent scheduling, and it's all about being able to retain our revenue from radiology appointments. We have been set a standard where we would order those orders, we would rely on patients to call us back, and we're flipping that on its head. When said physician orders an order, we're reaching out through AI, through text messages. If those text messages aren't communicated, we're then reaching out with AI voice. Our AI voice is named Hope. We've coined this. It's hospital outreach and patient engagement. And Hope will walk you through the scheduling your appointment, gathering those discrete details that we need, completing that pre-registration directly on the phone, so we can ensure that we're maximizing continuity of care, supporting our community, but also getting the benefits of the driven revenue. And then that obviously leads into prior authorizations. We've partnered with our partners at Notable. We're going to be introducing, and we should be live on this towards the end of the year, a product called Sidekick. We're referring to it as AVA. That's authorization, validation, automation. AVA is going to be driving through giving 2 to 3 times more productivity for our authorization staff to be able to have touchless submissions. And in the case that we do get any rejections, that they can go through the medical record, pull out the relative evidence, and apply that back to those authorizations to ensure that we move those seamlessly forward. And I'll land on this last one. We just turned hope on inbound. I mentioned outbound. As we continue to negotiate our insurance with some large insurance carriers here in our market, we needed a mechanism that allowed us to not have to pull staff off their day to day. So you could call a specific number, you'll get Hope. Hope will walk you through any insurance information, questions, answers, and if need to, get you to the right person to answer your questions. I know I've gone through, I have a couple more, but those are kind of the ones that are currently exciting me and that are currently in flight here at Southwest General.
Awesome. I love the names.
Yeah.
They're not just that you came up with naming them, but that you came up with naming them with meaning. Being
Yes.
able to come up with an acronym that fits and sounds like a person. That's not always the easiest thing to do. And I
Aaron,
think that.
I'll throw something at you on that. One of the most exciting times in the project for Project Radiant was having the project team go through the personas of the AI agent. And these are project members that this agent is going to be a part of their team once we kick it off. And being able to talk about the tone, quality, how it made them feel. And I think they were such a good patient advocate because they talked to the thousands of patients that we have. And it really was an exciting time for us. And, from my perspective, being in the business for 15, 20 years, it was mind boggling that we were going through this. But it was just a great time for everybody to realize where we're at with technology and truly how it's shaping this kind of evolution or revolution of healthcare going forward.
Yeah, that's it's incredible, in terms of the approach, and it's good to hear that you didn't just ask Copilot for a name. You know, that piece is still being done by humans, but
Yes.
so how did you approach that change management and the clinician training piece of things? You know, how did you build the trust that the AI is going to be successful and manage the solutions across your portfolio?
Yeah, and I think as we mentioned before, it's strong leadership at the top, driving through kind of their change management frameworks. we identified champions, and we've actually been identified as Oracle's AI champion of the state of Ohio. So driving down to staff, getting staff bought in from a clinical perspective, from administrative perspective, putting them at the forefront to help us make these decisions and how we drive changes to the technology, how we drive improvements to the technology. And I think what we've seen is as we've engaged staff and as this is something that's done with them, by them instead of to them, I feel we've naturally been able to peel back what you and I have very used to in the industry is resistance, right? This very, very resistance type of culture and being very transparent with the communication, very transparent with the data. I think we've had a perfect storm of staff really wanting to lean in because they see the value and a little bit of selfish for themselves, but they also see the value for their community, for the staff they work with, and their direct patients. And we've had very good feedback, and I would argue the ambient we've had a lot of chatter, and I think it's because it's the cascade across, the 80% of 400,000 patient visits that we currently have in our outpatient setting per year, where we're not just hearing it from staff, I'm also hearing good communication from patients. The doctor was able to look me in the white of the eyes and have one of the best conversations with me. I was able to speak my native tongue, and the AI was like, able to translate that back into the EMR appropriately. And I know those are very high level examples, but this is the type of feedback that translates back to staff that see the value, that then translates back to leadership, and it provides this underpinning evidence that we're going in the right direction, and that staff are definitely behind it as we move forward.
I think something that you said there is remarkable in terms of patients and people being concerned that AI removes the human element. And I think what you just highlighted is an opportunity not to remove the human element, but to actually add it back in through utilizing AI. And I don't think people recognize that opportunity enough. By having AI participate, it allows the doctor to participate in a different way.
I couldn't agree more, and I think you said it way more elegantly than I did.
Let's move on to kind of the future of AI and what everyone is getting excited about is the potential to hit home runs within AI and be able to accomplish great things. Is it something that you have to step into, or is it something that organizations should wait to see what comes out and what value can be delivered? How would you recommend organizations tackle this massive thing?
Yeah, don't wait. First of all, do not wait. And I don't know what you would be waiting for. I would say jump in, but however, you need to make sure you jump in with some guardrails. Obviously you hear a lot of talk about AI strategy and developing kind of these one-offs. That's not a direction that we chose. Yes, we have kind of a strategic direction on where we want to add AI into areas where we feel that it will underpin our strategy, but it's hire AI strategy or your principles into your organizational strategy. Make sure you have some great driving strategic pillars on how you're going to leverage these. Make sure that's wrapped in a blanket of responsible AI, as we've discussed in this enterprise. And then it's identifying, the top three use cases on how you're going to drive value to your organization. So to land that, I would say, don't wait. Start developing your plan now and capitalizing for your organization going forward.
And there are a lot of different ways to approach the partner piece of things with this too. You
Mhm.
mentioned a couple partners that you're working with, and notable on Oracle.
Correct.
There are so many different AI vendors out there, and so many PowerPoints that you can sit through. Well, first, can you talk a little bit about how you identify the partners that you're going to work very closely with, and And what is your stance on partnership with organizations? Is it try to minimize the number of partners as much as possible, or are you looking for particular areas where they have shown differentiated value? Yeah, how do you approach that?
Yeah, all those, you know, there's a thousand ways to kind of skin this AI cat, lack of better words. And we chose partners that allowed us to stick true to our platform approach. How we're managing our cybersecurity strategy, how we're managing our infrastructure strategy. We want to make sure that we're not adding point solutions across the organization that cause for duplicative contracts, duplicative interoperability needs, duplicative skill sets. And that is just tough to manage from an administrative perspective. And I personally would say that it adds additional unnecessary risk. So we wanted to drive down where we felt that a partner provided an AI platform that allowed us to grow, mature, run as fast, run as slow that we wanted to from an organization perspective. And we didn't have to go back and continually go through our onboarding contracting process when every time someone would come up with a great idea. We wanted to make sure that regardless of the innovation think tank, regardless of our idea think tank, that we could apply that to technology and allow us to move forward. And that's what led us to the Notable platform, where we have a flow builder where I can build any agentic workflow through a multitude using a multitude of different AI technology on a single platform. And then obviously having all the most robust security wrapped around that to ensure that we're keeping very, very close tie to our cybersecurity insurance, HHS, and NIS2 protocols.
That's really important, I think, in terms of understanding how the security piece fits in with
Mhm.
the vendors and how they approach security. Not just security, but also, one of the things that I've noticed in organizations is they implement AI, in particular, predictive AI, um, and they implement it in one fashion, and then people start utilizing it in another. And, I think there's a necessity to auditing AI over a period of time to make sure that there's not that creep in terms of functionality creep
Yes.
by the vendor, or or scope creep in terms of how it's being utilized. Is that something you focus on?
It, you're taking the words out of my mouth, and I think it's you could probably tiptoe into scope creep of use, but also actions of the AI, behaviors of the AI from quality, code, empathy, correctness, right? And we actually, with the platform that we have, and I was doing this today, I can go into any agentic workflow. I have a dashboard that tells me the use, how many times it's been used, what's the value we've been able to retain off of that. But I also have a quality check that all of our flows incorporate. So I can go through and we give it a score, and it's good or bad. It's very simple. Is And we score every single action that way from a quality perspective. And as we collectively complete that, it then allows us to course correct. It allows us to go back to the vendor with some modifications or changes, but it also allows for staff, and this just is not an IT function. This is a business function of the staffs that are flexing this technology in their areas. It allows them to stay in control, stay embedded in the process. But I think to your earlier point, it also allows them to continually to build trust, because at the end of the day, they're the ones guiding the ship by taking in some of those quality controls that we've mentioned and applying anywhere that needs changes.
Yeah, and what you just articulated too is a structure around innovation. And I think a lot of people think about innovation as over here and over here and over here. And having that structure, that underlying structure that supports innovation, not just from when something gets implemented, but as it matures throughout the organization and as it gets utilized further throughout the organization, that structure is really important to make it scale and really take advantage of the innovative mindset of AI. Let's talk in terms of the future. I'd love to hear 3 to 5 things that, Jay, you are really excited about this coming in the future of AI.
So, so I'd probably start with, and I know this isn't per se AI, but the movement of where the federal government is working with EFCA and creating this kind of federal health information data exchange, where other qualified health integrated networks, QHINs, will connect and then truly have this large data exchange from healthcare across the organization where we can tie into. And then from there, what we can do with all of that rich data going forward. So, from first perspective is getting hands on more rich, clean data for the organization. But I think from a technology perspective, I think we're going to see kind of this ambient or these Internet of Things, IoT devices and smart devices continues to be more put out into the four corners of patients' homes. What's funny is I think in 2018, 2019, I had a business in Hong Kong, and we were flying many, many places, and we had the opportunity to go to Shenzhen, China, and we were helping this company called Centrex, and we were helping with these predictive analysis and the predictive models that created a digital you from a patient perspective. And what they wanted to do from from a Chinese perspective is they wanted to reduce the risk of insurers by leveraging technology to the insured to the patients to reduce the risks. Where patients could walk into the clinic, they would have the Internet of Things. They would check their gut profile. They would look at their skin color, their blood pressure through these IoT devices, and it would calculate this information. It would run it through a mathematical model. And me, as the patient that has subscribed to this service, would get a notification on my app. And my digital me would tell me that I was going to get sick in 2 weeks. And if I didn't want to get sick, if I did want to go through that week of being under the covers with the fever, etc., that I could change my eating habits or my exercise prior to getting sick to avoid that episode. And I see this as continuously being something that AI is going to help us drive faster to, is creating a digital you, a digital me, a digital we that really is taking all of this data that I've mentioned and really giving it to patients to allow them to stay out of the bricks and mortar, to stay healthy, to be more proactive. Um, I'm really excited about that, and I see kind of hints in places about it across the industry. In addition to that, I think we're going to get more predictive in our workforce automation, more intelligent robotic systems that are going to be out in the four corners of both healthcare, supporting patients, but I think more importantly, supporting staff and supporting operations.
Yeah, I love that example too because being a population health guy, I did a lot with value-based care when I was working with Henry Ford Health System. I was responsible for the IT aspects of that, and one of the big things that we always focused on was how much of an impact healthcare has on an individual and their health versus the social dynamics, their habits, their genetics, things of that nature. And as you start thinking about big data from an analytics standpoint and the opportunity to be able to utilize AI to look at data across all those elements that contribute to an individual's health, the power is amazing. I mean, to be able to intervene at the lowest cost point becomes just like you're saying, hey, Aaron, you shouldn't have eaten that. You're going to get sick in a couple weeks unless you do X, go work out, whatever it happens to be. Jay, thank you so much for joining us. This was really exciting to talk through. It's exciting to hear what Southwest's doing. And I think the model that you have that, isn't just about technology. It's about selecting the right vendors, how you select those vendors. It's about culture change. It's about the human element. And you articulated so much of that. And I think there's some great lessons learned in the conversation that we had today for other organizations to pick up and run with. And thank you again. It's a
No problem.
pleasure as always. Look forward to staying in touch and hopefully you can join us again in the future.
Perfect. Thank you, Aaron. Great to be here. If you ever want to burn some time or need some space to fill on one of your podcasts, keep Southwest in mind.